Minister Zweli Mkhize also saying that the suspension of the rollout of the Johnson & Johnson COVID-19 vaccine should be brief and will therefore not have any major impact on South Africa's vaccination drive. The background: the U.S. Food and Drug Administration drew much attention after announcing the temporary suspension of the use of this vaccine in America. That country reported 6 cases where patients developed rare and severe blood clots. One of those patients sadly died. Now, the same vaccine is being used and administered to almost 290,000 healthcare workers here at home, and more vaccines are en route for South Africa's mass vaccination drive. So what should we make of all these developments? For perspective, let's bring in Professor Gail Bekker, who co-led the investigation, or who is the co-lead investigator for the Johnson & Johnson SA trial, joining us now for our video link from Cape Town. Prof, always great getting your insights on this. Thanks once again for making time. I want to start by asking plainly, how worried are you about the potential fallout from this decision?
Yes, I think I under you right. Vaccine hesitancy is the other end of the scale, isn't it? And we do want to get things back on the road. I think it is really important to keep perspective, and I think the Health Minister is right that we need to be calm. At the same time, you know, these are serious side effects, albeit very rare, and we feel that because this is a research protocol that we are, rolling out at the moment, it's important we get that information to the potential vaccinees. And so we're taking a bit of time to make sure that all the informed consent documents, etc., contain the information and that, we do this correctly. So I think it is weighing up the risks and the benefits. Certainly, when we weigh up the impact of COVID, things still look very positive towards vaccination, there's no doubt. But as I say, I think a short pause just to make sure we get our ducks back in a row.
Yeah, we're told that the type of blood clotting is rare but severe. What else do we know about it?
So we know that it occurred in 6 women. So it does seem to be a preponderance in young women, and that fact that they are young. So I think that always gives us even more cause to pause. We know that COVID-19 is more severe in the elderly and people with comorbidities. So when we see side effects happening in young people, that again makes us a little concerned. And we again just want to make sure we've got all the information we need. I did listen to the FDA briefing yesterday. Unfortunately, there doesn't seem to be a common thread amongst those 6 women, but obviously it's a small number of people. But I think we are hoping to get more information from the FDA and from Johnson & Johnson today about all of those cases, and we'll be reviewing what medication they might have been on. We know that contraception can also be a potential trigger for something like this, so we want to get all that information in today and try and put the picture together.
Yeah. The key, of course, is to try to create some kind of causal link or to establish if one does in fact exist. Let's entertain the scenario that it does. Does that then suggest that we throw the baby out with the bathwater by completely stopping the use of the Johnson & Johnson vaccine? Or is there room to suggest that after taking the vaccine, you supplement that with medication to prevent something like blood clotting?
That's right. So, I don't think the baby goes out with the bathwater at all. We know this is a very effective vaccine. It's one of, as Dr. Mkhize said last night, it's one of the armamentarium. We don't want to lose any of our potential ways to fight back on the COVID-19 pandemic. So I think it's important that we then think what the possible scenarios are. It may be that we have to be particularly cautious or use a different kind of vaccine in a particular group of people, or we may need to, as you say, take particular precautions. But certainly, I don't think it means that we would completely disregard this important tool. We know it's effective, and this is a rare event. It's important to weigh the risks and the benefits, as I say.
Yeah. I mean, you'll guide me about the type of questions you're asking yourself as you try to ascertain whether there is, in fact, a causal link between the vaccine itself and the blood clotting. But I imagine one of the questions to be asked is, how prominent is this blood clotting in any population in the absence of the vaccines? And is there an uptick because these vaccines are being administered?
Yeah, I think that's always the way we handle any rollout of any vaccine is we try to keep a handle on what's happening in the general population anyway, because it's always as important. Everybody becomes more aware of side effects or medical conditions, and it's important for us to weigh that up with what is happening as part of general living, right? We know that clots are a very common occurrence, actually. So I think, again, it's the nature of these clots that make them perhaps more potentially causally linked to the vaccine. I think we just want to understand this a little bit better, make sure the documentation is clear, and then hopefully, as I say, get right back on the horse and make sure we get vaccines into arms again. The vaccines are in country. We know that this is an important thing to do, and we feel a huge sense of urgency to get beyond this hump in the road, if you like.
Yeah. I know you can't say much about the AstraZeneca vaccine itself, but I can't help but notice commentary that had been made previously that, in fact, the Johnson & Johnson vaccine as well as the AstraZeneca vaccine used similar technology in their development. It just so happens that these are the two vaccines that are suspected to also to be linked to blood clotting, beg your pardon. What information does that give you, if anything, about ways through which this probe could take place?
Yeah, I think it does raise the vector. So these are both vector vaccines. In other words, they use another mechanism to deliver the vaccine into the human body. In this case, it's an adenovirus. They are different. For AstraZeneca, it's a chimp adenovirus. In terms of Ad26, in Johnson & Johnson, it's a human adenovirus that causes a common cold that has been disabled. It does raise the question, is it the adenovirus that's causing this? But we also know that there's genetic material that's coming from the virus, which is part of the vaccine. Could it be that? So, I think the questions remain. But, I know the FDA is making that link at this moment, and it makes sense. I just think we don't absolutely know that yet. I think we have to keep that question open.
Absolutely. One can only hope that we'll get those answers to those critical questions sooner rather than later. Thanks so much for your time. Really appreciate your sharing with us what you can at this very early stage of what is undoubtedly a complex moment in the world's fight against COVID-19. Professor Linda Gail Bekker is director of the UCT Desmond Tutu HIV Center. Is also the co-lead investigator in the Johnson & Johnson South Africa trial.